Greece Arcadia High School AP Biology, Anatomy and Physiology students, along with one living environment team, performed surgery at the Titan Memorial Hospital. Students chose their body system in pathology, researched and networked with professionals to learn how to perform the surgery, built their patients' bodies, and developed their profiles. Surgery was performed to an audience of middle school science classes and high school living environment students.
You have 2 minutes.
The clotting on the brain, basically.
Yep, between
and
the
it's trauma induced. So basically, like if you had like a car accident or if you like keep going, if you had like if you were like in like a sports gang or you got like something like that. So just any like traumatic incident that happens.
Okay, start the surgery.
All right, so
First, we shave the head. Fun, right? And then
we rub it with iodine solution to keep it clean. All right.
Do you need these notes?
Yeah, they should be writing things down.
So the first thing you do is you shave the head.
You want to come in and look?
And then we'll clean it with iodine solution and cut the scalpel open. Cut the scalp open with the scalpel.
And then with a drill, you drill the skull open. You take out a piece of the skull wherever the hematoma is located at.
All right, so between the dura mater and the brain, we have our hematoma. So we're just gonna...
In a professional surgery, you would suction it out. But here, we need to scoop it out.
In real life, it's similar to the consistency of jelly.
Or jello.
Yeah, and depending on what kind we have, which we have an acute here.
Dixon's getting all the shots for us. You'll lay the layers back and suture them together with disposable stitches.
And then the patches or the piece of skin that you took off, you're gonna staple it back together, and then you'll remove the staples after it's healed.
So in this type of situation, we sew it back together, staple the skin back together, and then the person goes right back into recovery.
Yeah.
Our surgery is a C-section. Our patient is obviously a female. She's pregnant and she has a condition called eclampsia, which is a swelling and it's caused by high blood pressure. So this is life-threatening to the mother and the child.
We might do another sit down.
Alright, so the female has preeclampsia until she has a seizure. So what we're doing is we're just going to wait until she has a seizure. When she does have the seizure, we're going to inject magnesia in her arm to induce the labor. And if the birth doesn't come naturally, we'll do an urgent C-section because due to the thinning of the blood, if we don't do the C-section in a timely fashion, then she could bleed out.
So the first step in our procedure was obviously to get dressed and put the drape over because she is awake, so we don't want her to see what we're doing. The second step is I'm going to take a scalpel.
Oh, she's awake.
A 6-inch incision right from hip to hip.
I know we're actually 100 at the time, but
Alright, so next I'm going to poke through the fascia, and the fascia is a membrane that holds all the organs and all the muscles in place. Yeah. And now 2 people are going to stand on each side of her, and we're going to pull out the muscles starting at the midline in her abdomen. We're going to pull them to each side so we can go inside to the uterus.
so I'm going to use the scalpel and make a vertical incision into the uterus.
James T. Morrison, and earlier in the week he was diagnosed with lupus at our hospital and we scheduled him for a kidney biopsy surgery. So the body system that we're going to be working with involves the kidneys, and that is the excretory system. performing this kidney biopsy because lupus is a very tricky disease. It's different for everyone who has it, and basically what happens with lupus is it's an autoimmune disease, so your body's immune system attacks itself, so it affects everyone differently. So the best way to diagnose treatment is to perform a kidney biopsy and take a small sample of the kidney tissue and run it through tests to see which medication will react best with the person. So what we're going to be doing today is we're going to be performing a kidney biopsy where we're going to be looking at the kidney along with the adrenal gland attached to it, and right next to it is going to be the large intestine where all your food absorbs the water into your body. So I will be narrating the procedure today, and Dr. Evans is our head surgeon here, and these are our 2 interns, and we're going to be teaching them how to perform a kidney biopsy. So if we are going to start, everyone get their masks on.
A little bit. Alright. Now ready to make the first decision.
First we are going to be wiping the area full to eliminate any sort of bacteria or virus that might be resting on the skin. And at this point, Dr. Evans is going to make a longitudinal scissor down the back in the area that we're going to be working with. He is using a scalpel, which is the most common used tool for opening up the original skin. And Dr. Cimino is dabbing the skin because anytime that you open up the skin, different little tiny veins in your skin are going to open up and start bleeding. Dr. Evans is now performing a horizontal scissor, and this is so we can fold back the 4 different flaps of the skin and expose the kidney. We're doing an open kidney biopsy, meaning that we're actually going to be seeing the kidney as we're cutting into it. Alright. At this time, we are now going to be folding the flaps of the skin back, just enough so we can see the kidney. And Dr. Cimino had to be called away on an emergency ER for a girl who overdosed, so I am actually going to be stepping in. Alright, I got this part. You hold that open. Dr. Evans is now going to be making a small incision into the upper right quadrant of the kidney. And he's going to be making more of a triangular cut. Also at this time, there is going to be a lot of blood being let out, so we are going to be dabbing it. The kidneys are very, very full of blood, and it's actually a very good spot to perform this biopsy because there is so much blood, meaning that there is a lot of white blood cells there that we're going to be testing.
All right. Dr. Kroll, if you can get a scalpel and help me remove this. Dr. Roth, if you could get ready with the tray.
At this time, we are now taking out the portion of the kidney that we are going to be testing.
Yum.
It's a very delicate process. All right, very nice. Now we are going to be making some small sutures to the kidney.
The smaller suture, if there is one. We'll use this one.
Yep. And we're going to be sewing up the kidney, so afterwards, because we took a part out, we want the kidney to heal right. This is a very commonly done procedure and it's one of the most successful procedures that are done in hospitals, which is why it's a very good technique to teach interns, because there is not a lot of risk involved with it.
I mean, the sparkling.
That hurts right there.
Yeah, he was in an accident too. That's when we found out about the heart problem. Alright, let's go.
He's never gonna look as good as the first time.
Scalpel. Alright, you have to explain.
Okay, so we gotta cut through the skin. Once we get through the skin and the muscles and stuff like that, we're gonna reach the sternum. So we gotta hold the skin back somehow. So
They would use clamps in real
they
surgery.
use thick clamps that'll hold it down. So we gotta hold the skin down. Then we gotta cut through the sternum.
This is, and then for this they would use a saw, like a machine.
Yeah, and then they hold it apart with a thing called a sternal retractor.
And so then these are the ribs, and we open up the ribs.
That looks beautiful.
It was gonna be made out of pasta and like sauce. You weren't there for the pasta part.
Oh, yeah, you were telling me about that.
Oh yeah. And so here's the heart. It's beating. Imagine it. And then we flip it over to find. Oh look, there's plaque in there. We must get that out so that there's blood. The blood can flow more healthy.
So we pull a vein from the leg.
A healthy vein. There's only 4 veins that we can take that we can use for the heart here. So there's here in the legs, there's 2, and then there's 2. They're called mammary arteries here that we can use. So we took the one from the leg that was healthy, that was clean, that blood can pass through more easily. And so here that we would clamp these 2 places so the blood is not spewing everywhere. After that, we would take the now that's clean and like has nothing blocking it. We would attach it here and use stitches, and then we would place it here, and it would fuse together. Okay.
Over time, you suture it. Like,
yes, you know how a wound heals.
It's so small you can't see it with your eye, so it takes a long time to be able to do this stuff.
And then we flip it back over to its normal position, and then we take these and put them back. We put them back together.
And then the sternum over time is broken, but it'll heal eventually.
It's like a broken bone.
Exactly.
And so then we would take the clamps off.
And then we sew it back together.
And then, and then it would heal.
Yeah. We had a 10-year-old boy who came in with some swelling in his hands and his feet and his face. And he had a bit of a fever and some bloody diarrhea. Gross, I know. Because we didn't catch it in time, he has a case of acute hemolytic uremic syndrome, meaning it's basically a type of anemia that affects your immune system, your red blood cells, as well as your kidneys, actually. And unfortunately, because we caught it late, we weren't able to prevent him from going into renal failure. So we were performing a kidney transplant. He needs a new kidney.
One surgeon taught unusual medical issues. Volunteers from local medical fields were on hand to show the workings of an ambulance, perform CPR, intubation procedures, and ultrasound machines. And how did the students in the audience respond?
Oh, how did it go for you yesterday?
It was really cool. A lot of the kids really enjoyed it. They, a bunch of them that I asked, they said that since their parents were in the doctor field, they really wanted to become like surgeons. And so, especially with the lung transplant in my group, the kids were like, yeah, I want to be the person that wants to like transplant the lungs. So it was cool that we could like affect the kids that way.